Mr. Chairman, members of the board, as you all know, we continue to respond to the pandemic of the novel COVID-19 virus. I was asked to provide you with an update of our continued efforts since your last meeting. Our team has been working diligently to ensure that we are supporting the needs of our communities throughout Botetourt County. I felt it important that you hear our updates from the various team members responsible for helping meet our mission.
As the Deputy Chief of Fire and EMS, my top priority throughout this pandemic has been to ensure the safety and health of our workforce so that we can ensure that our continuity of operations during this pandemic and continue to deliver excellent service to the citizens of Botetourt County. We believe in facts, not fear. Together, our team has worked to ensure that all emergency responders receive clear guidance on appropriate response guidelines and receive the latest updates based on available science and our evolving understanding of this novel coronavirus. Through coordination with our medical director and a team of expert physicians, epidemiologists, and emergency management professionals, we are working diligently to ensure our responders have the very best information and tools available to protect our community. We issued our first detailed guidance to your Botetourt County emergency responders in January, less than a week after the first case was identified in the United States. Since that time, we have made regular updates to our response protocols, including the addition of COVID-19 medical screening questions in our 911 center, providing guidance on responder personal protective equipment and safe work practices, and even instituted a responder medical surveillance program that has now been instituted throughout county government.
As the emergency manager, I've been extremely busy working in our Emergency Operations Center, our EOC, to ensure that we are planning for and responding to the needs of the community as a whole. Emergency management takes an all-hazards approach to emergencies. This pandemic, while a public health emergency, is certainly unique and unprecedented in modern times. Thus, a lot of the response has been a challenge on all levels. The EOC has been our single coordination point with the Virginia Department of Emergency Management, FEMA, and our other internal and external stakeholders. Working in coordination with various departments and entities, we have been able to maintain coordinated communication with VDEM on our current and projected needs, as well as order crucial supplies to ensure we are being considered for PPE and disinfecting products. Additionally, we have been participating in an inordinate amount of conference calls and virtual meetings. We have been involved in coordination with public health, local government officials, regional healthcare systems, long-term care facilities, emergency managers from around the region, and even our stakeholders in fatality management. A new initiative during this pandemic has been the production and release of public messaging through videos. Using my previous experience with video editing, I have been able to work with various stakeholders to produce and edit videos for public release. Finally, our EOC has been working hard to ensure a common operating picture is available. Using a variety of technology, we've been able to maintain an up-to-date external and internal dashboards with information on the number of cases in our area, as well as bulletins and safety information. We will continue to maximize the use of technology we have available to keep the community and all of our stakeholders informed.
While responding to the coronavirus has been our top priority, we have still maintained a broad focus on fires and other natural and man-made emergency situations that can impact our community. As you can imagine, some of the social distancing requirements have made life a little different in the firehouse, but it has not stopped our progress. Over the last few months, we have been working to cross-train 3 of our career firefighter EMTs as engine company driver operators. While we have ensured we work in small groups, this has been great for all of us, as many of us have been able to participate in elements of this hands-on practical instruction. Additionally, we have worked to find new ways to enhance our distributed training through the use of research projects, video conferencing, and our increased use of internet-based continuing education.
As captain of training, I've been constantly working with our partners in Roanoke City, Roanoke County, and the city of Salem to redesign the structure of the Regional Recruit Academy. Botetourt has 6 of the 34 recruits enrolled, and since the beginning of the response to the coronavirus, we have been challenged with identifying the safest means of continuing the academy during these unprecedented times. We have worked to keep the academy flowing by socially distancing, modifying our instructional delivery, and reducing the class sizes. The current timeline allows for our 6 Botetourt recruits to graduate on July 10th. In addition to training our 6 employees at the Regional Training Center in Salem, we have 4 new part-time employees who are currently training to help provide relief to the schedule. With COVID-19, unfortunately, many of our originally planned courses, such as the 2020 Volunteer Fire Academy, had to be postponed. I continue to work with all of the agencies that oversee the delivery of training to put forth the best plan possible to get these programs back on track as soon as it is safe and feasible to do so.
As fleet manager, I have maintained focus on my normal operations of keeping our rolling stock operating safe and efficient. There continue to be items as part of my normal workload that receive attention throughout this pandemic, from continuing to work on the full implementation of DUDE solutions, responding to evolving apparatus service needs, and assisting with many ongoing apparatus projects, such as the implementation of the bottle truck program and the compressor program. I have also taken steps to reduce the risk of exposure within the apparatus. Ambulances now have a barrier placed between the cab and the patient compartment, minimizing transmission possibly between the two. In coordinating efforts to implement more protective measures for our safety providers, I have constructed and installed temporary patient isolate frames on the stretchers to be used when treating patients with procedures that create aerosolized particles. Additionally, I have installed new antimicrobial cabin air filters in all frontline ambulances in a further effort to minimize exposures. Finally, I have been working in conjunction with the EOC in our efforts to source supplies and serve as logistical support for the transportation and acquisition of regionally acquired supplies.
As the battalion chief responsible for emergency medical services, there has been a great deal of activity and coordination with our medical direction. One of the first major projects was to ensure all staff and EMS volunteers received mask fit testing. Personal protective equipment, PPE, has been one of the most challenging commodities to come by during this pandemic. That said, a significant amount of my time has been focused on maintaining accurate counts of PPE and tracking of burn rates so that reports can be submitted to regional and state coordination agencies. A process of reporting PPE counts twice daily was established early on and remains in place. Additionally, our medical director was able to achieve an emergency board of pharmacy license for our department. This license enables us to order special medication for a critical care procedure known as RSI. This procedure has been instituted for patients meeting certain criteria, such as extreme respiratory distress. By being able to put these patients in a medically induced coma and placing a breathing tube and ventilating them off of our mechanical ventilator, these patients will receive a higher degree of medical care and hopefully a better outcome. We continue to look for ways to provide the best pre-hospital care possible to our patients.
As the office manager during this unpredictable time, I have once again pulled out my workbook for FEMA public assistance documentation. As in the past, with events such as significant and widespread snowstorms and the derecho, I take on a financial administrative role within the ICS structure. In coordination with various departments, we have been tracking all of the costs identified as being part of the COVID-19 response. The initial deadline for filing a preliminary damage assessment was Friday, April 17th. In filing for public assistance, we stand the potential to receive a public assistance grant from FEMA for up to 75% of qualified expenses. The initial damage assessment within the first month of our COVID-19 response was just over $45,000. In addition to these temporary responsibilities, I continue to work both in person and remotely to ensure accounts payable, payroll, scheduling, and other normal duties are carried out without the issue. The responsibilities of public assistance and the recovery coordination will continue well after the coronavirus is gone. It will continue to be a priority to ensure maximum public assistance grant funding documentation is kept, grants are applied for, and the funds receipted.
As you've heard from our team, we continue to exert a great deal of our efforts to ensuring that we are responding to meet the needs of the community, working with our partners locally, regionally, and at the state to access resources, coordinate efforts and prepare for recovery from this disaster. I cannot be more proud of the men and women on our team that are performing at their very best to ensure Botetourt County is receiving the highest level of services possible. Thank you for your support through these difficult times.